Oh, wow, there's so many people here. It's exciting. So my name is Jodie. I am a second-year PhD student in the Radiological Sciences program, and that's going to be the only time I introduce myself that way, because within Radiological Sciences, what I actually study is medical physics. Everyone has heard of radiology, but if you say medical physics, you're going to raise a lot more eyebrows, you're going to spark a lot more conversations when you say that. So I'm Jodie. I'm studying medical physics right now. Tonight you're going to hear lots of really cool stories from my colleagues about the day that they woke up and knew they were going to be a scientist. My story is a little bit different. It's a story of someone who was interested in what seemed like way too many sciences all at the same time and trying to find her path. So I studied physics as an undergraduate because as a subject, it's pretty broad as far as sciences go, and for some reason I was good at it. I don't know how that happened. And I also studied philosophy. It turned out that I enjoyed thinking about science just as much as I enjoyed doing it. So subjects of philosophy of science, theory of mind, these things were just as cool to me as the physics that I was learning in the classroom and in the lab. So by the time I graduated, I had heard of graduate school. I'd heard of getting your doctorate. It sounded like a cool thing for me, but if I could only narrow down what it was I wanted to study. So I wasn't ready to make that leap yet. So I was sworn into my institution's master's program for computer science, even though I'd never written a line of code in my life. They just said, you'll be fine, just go for it. I was fine eventually, and it turned out that I loved computer science too. So it seemed like I was casting an even wider net for myself, but luckily amid all of these studies, I did go to a conference where I heard a woman give a very cool presentation on medical physics. I'd never heard of it before. But I did more research, I heard about UTHSCSA, and then I ended up here. So an antiquated definition for what medical physics actually is, very generally, any time that you have radiation in medicine, you want a physicist present, and that happens quite a bit. Our program is about 4 years long, so we do about 2 years of coursework, your qualifying examinations, and then research for your dissertation. Then you're done. Many of us will go on to take boards and complete residencies, much like medical students do. And then when you're done, there's about 3 general things you can do as a medical physicist. The first would be if you want to bring home the big bucks, you can be a therapy physicist. They work alongside oncologists to help plan radiation treatments for cancer therapy. Another major branch of medical physics would be that of health physics. So that is maintaining radiation safety in places like UTHSCSA and in hospitals and whatnot. So our own environmental health and safety officer here at UTHSCSA, Dr. Michael Charlton, he is also a certified medical health physicist. So in addition to making sure we do safe radiation practices here, he's also the person who gets called when someone in the dental building burns a bag of popcorn and the fire trucks have to come. So please pop responsibly, everyone, for Michael Charlton. And then the other major sect of medical physics would be that of imaging physics, so using radiation and other new things nowadays to image the human body. So what I get to do, I work over in the Research Imaging Institute. I get to do all of the cool things that I really like. Perfect intersection. I do data mining on massive amounts of brain data in people who suffer from depression. Just a really cool intersection of all of these fields. I do have quite a passion for mental health, research in mental illness. It's kind of a mysterious field right now, so what we're doing, studying the physical mechanisms and markers we can actually see in the brain for people who have these disorders, I think it's going to be big news someday, and UTHSCSA was the perfect place for me. I'm glad I'm here. Thanks, guys.
Wow, that's going to be a tough act to follow. Hi, everybody. My name is Ahsan Choudary. Cameraman, I'm sorry, but you're going to have to follow me around. He's going to hate me. First of all, I want to thank Teresa, Charlotte, Nicole, and Lakeisha for helping put this together. Thank you very much. We need this. I'm a student in the Translational Science PhD program. So when I told somebody about my degree, what I'm seeking it in, this person asked me, oh, so what language are you studying? And I said, nope, sorry, I'm not translating Swahili into English. I'm studying a multidisciplinary science. So translational science was started here at the Health Science Center about 5 years ago. We have a pretty small class, and the purpose of translational science is basically a little bit of what we're doing here today. It's the interprofessional interaction between scientists, physicians, dentists, physical therapists, to try to find innovative discoveries to some of the most chronic and some of the most critical care needs in terms of disease that we have today. So translational science looks to try to speed the discoveries in the clinic into discoveries at the bench side to treatment in the clinic, and then assess which of those treatments in the clinic are most effective, cost-effective, and to try to make best medical practice guidelines based on that. So in a nutshell, that's basically what we do. So as scientists, we're kind of experts in our field, but we are also liaisons into the other sciences. So we try to hook people up, so to speak. So it's non-traditional, much like me. I'm going to give you a little bit of a background. I graduated Texas Lutheran in 1999. That's a long time ago. I came to UTHSCSA to do research. I've done research here before I was a student for about 10 years almost. And then I was also in the Guard. I was a chief warrant officer. And I was a chemical, biological, radiological, nuclear tech. So yeah, that's a mouthful. Say that 3 times fast. So as a warrant officer, I was an expert within my field. But then at the same time, I was a liaison between the officers and the enlisted. So that was a perfect fit for my translational science program. It was very non-traditional. And so I continued my research, and I originally thought that I wanted to go to medical school, be an emergency room physician, go with the special forces around the world. But then I met her. And she said she probably couldn't be with somebody who's deployed all the time. So I had a tough decision to make. I chose her, obviously, right? So then I thought to myself, okay, if not a physician, what do I want to do? I want to have patient contact. I want to have interaction with patients. I want to work in a multidisciplinary field where I can talk with people from different disciplines, try to work on something innovative. And so, fortunately, the Translational Science program was started here at the Health Science Center. So I applied, I got accepted, and never in my life have I felt so supported and welcomed as I have in the graduate school and the Translational Science program, and here at UTHSCSA. And so, on a daily basis, I get to interact with people who have a drive and a vision that's greater than mine, or at least equal to mine, and that's inspiring. All of you have a vision. All of you have a goal that one day you want to put to work. You're going to be playing a critical role in healthcare. And so we all have different areas that we're experts in. So if we learn to communicate in an interdisciplinary way, come to the table, talk, become friends, we can get a lot done for the critical care needs that we have in healthcare. So real fast, I've been fortunate to kind of find my life's journey, I think. I am involved in some science communication things because science belongs to us all. The problem is that a lot of scientists don't necessarily communicate science as effectively as one would hope. And that's the fault of some scientists. So, you know, to be able to do that, you have to be able to speak clearly, you have to be able to communicate what you're doing in a way that's accessible to everybody. And so, fortunately, I was involved in an event called Science Fiesta that Travis Block over there helped organize, along with Milos Marinkovic. And so, that was a great way of getting involved in the science communication portion of it. Currently, I'm also working on trying to set up something that's related to crowdfunding for a lot of young scientists. Try to get biotech built in San Antonio. We have a great biotech city. A lot of people don't know that. And so to try to get the word out, to show them how wonderful the Health Science Center is as a part of the biotech industry in San Antonio is critical. Another interest of mine is innovation through public-private partnerships. So fortunately, there has been, I have a friend who's a CEO of a startup company here. He's bringing his technology into the Health Science Center, and it's a technology that helps scientists manage big data. In the world of genomics, proteomics, metabolomics, a lot of big omics, a lot of big words, but basically we have a lot of information we don't know what to do with. So he has software that can help scientists manage that better. I also work in a technology consulting group, so that works with the Office of Tech Commercialization. Tech Commercialization. And so we try to help bring some of the newest discoveries at the Health Science Center to clinics and to try to bring them to consumers so they can find that treatment quickly. But I think the most important thing is that we have to work effectively as a team to be able to tackle these problems that I was talking about. It's our responsibility as contributors to healthcare, each one of us, whether you're a physical therapist, a dentist, a nurse, a physician, we all have a responsibility not only to patients, but to ourselves as professionals across disciplines to build the kind of relationships that we need to carry this forward and to find, treatments and cures for cancer and diabetes and heart disease and all the kind of maladies that are out there. So this is only one of the reasons that we need to reach out across schools, across disciplines, and to try to understand each other's life journey. And I think that this is a great forum to do that. Thank you.